Is walking good or bad for sciatica? For most people, walking can be a good way to stay active. But how you walk and how your symptoms respond matters. So in this video, I'll show you how to walk with sciatica, a few simple adjustments you can make that'll make it more comfortable, and the warning signs to tell you when it's time to stop. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Orillia, Ontario. So is walking actually good for sciatica? For most people, staying active is generally better than spending long periods of time sitting or lying down. And walking can be one of the easiest ways to do that. But I want to make an important distinction. Walking isn't a treatment that magically fixes the sciatic nerve. Think of it as a way to maintain some movement while your symptoms settle down. This matters because when a sciatica hurts, your natural reaction may be to protect the leg. So you walk less, sit more, and sometimes avoid movement altogether, because you're worried that you're going to make the problem worse. For a short period during the severe flare-up, you may need to reduce your activity, but prolonged bed rest usually isn't the goal. And current recommendations actually encourage continuing normal activities as much as you comfortably can, gradually sitting and getting moving again. And you don't need to walk for 30 minutes to make that worthwhile. If you can only comfortably walk for 5 minutes before your leg starts bothering you, start there. You could do several shorter walks throughout the day, instead of forcing yourself through one long walk that leaves your symptoms irritated for hours afterwards. That's an important principle with sciatica. More isn't necessarily better. Your starting point should be based on what you can currently tolerate. And don't judge the walk only by how you feel during the walk, but pay attention to what happens afterwards. If a 10-minute walk consistently leaves your leg feeling more painful for the rest of the day, that's probably too much right now. Shorten the distance or duration and see how your symptoms respond. Once you've found a tolerable amount of walking, the next question is, can changing the way you walk make it more comfortable? One of the first things I would change is your stride length. When your leg hurts, it's common to either limp and guard the leg or try to walk exactly the way you normally would. Instead, try taking slightly shorter and more comfortable steps. You don't need to shuffle and you don't need to cut your stride by some exact percentage. Just avoid reaching your foot too far out in front of you. A shorter stride can reduce how much your hip and leg move through each step, and some clinical guidance specifically recommend shortening the stride when walking aggravates your sciatica. Next, slow down. This is the time to power walk through the pain. Choose a pace where your movement feels relaxed and controlled. If slowing down and shortening your steps allows you to walk with fewer symptoms, that's more useful right now than trying to maintain your normal speed. And pay attention to your posture, but don't overthink it. You don't need to brace your core as hard as possible or force yourself into a perfectly upright posture. In fact, there isn't one ideal walking posture for every person with sciatica. Different positions can feel better or worse depending on what's irritating the nerve. Instead, start in a comfortable, relaxed position and experiment with small adjustments. You can also make the walk itself easier to control. Start on flat, predictable ground rather than hills or uneven trails. And walk somewhere that makes it easy to turn around if your symptoms increase. And if 10 continuous minutes is too much, 2 5-minute walks may be much more manageable. The goal isn't to make your walking look perfect, it's to find the walking that keeps you moving without necessarily aggravating your symptoms. But how do you actually know whether those symptoms are acceptable or whether walking is making your sciatica worse? That's where the location of your symptoms becomes really important. One of the best things to pay attention to isn't just how much pain you have, it's where that pain is going. There's a clinical concept called centralization. This is when symptoms that were traveling farther down your leg begin moving back towards your buttock or lower back. For example, maybe you start your walk with pain going down into your calf, but after a few minutes, the calf pain settles and you mainly feel it up around your buttock. That pattern can be a favorable response. The opposite is called peripheralization. That's when your symptoms begin traveling farther away from your source and your back and further down the leg. So maybe you start with pain around your back or buttock, but as you continue walking, it begins spreading into your calf or down into your foot. That's a sign I would pay attention to, especially if the symptoms continue to worsen as you walk. This is why pain intensity alone doesn't always tell the whole story. With sciatica, changes in the location and type of your symptoms can give you useful information about how you're responding to an activity. Clinical guidance also recommends letting your symptoms guide activity and avoiding repeated aggravation of the nerve. So don't just ask, does walking hurt? Ask, what happens to my symptoms as I keep walking? Because while some changes may simply mean you need to adjust your walk, Others are a sign that you shouldn't keep pushing through. If your leg pain, tingling, or numbness progressively worsens or travels farther down your leg as you walk, that's a sign to back off. Slow down, shorten the walk, or stop and see whether your symptoms settle. But pain isn't the only thing to watch. New or worsening weakness deserves more attention. For example, if your foot suddenly starts dragging, or you're repeatedly catching your toes, or you're having increasing difficulty lifting the front of your foot, that's not something I would recommend trying to walk through. Progressive neurologic weakness with sciatica needs a professional assessment. And there are a few symptoms that change this from a walking question to a medical emergency. If you develop new numbness around the groin or genitals, or the area you would sit on a saddle, or you suddenly have difficulty starting urination, or you can't tell when your bladder is full, or you lose bladder or bowel control, or develop new sexual dysfunction, you need to immediately seek medical assessment. Those can be warning signs of cauda equina syndrome, a rare but serious condition where the bundle of nerves at the bottom of your spinal canal becomes compressed. These symptoms, although rare, are a medical emergency and require immediate emergency room evaluation. So walking with sciatica isn't simply bad or good. Start with an amount you can tolerate and make the walk comfortable. And most importantly, pay attention to how your symptoms respond. Your symptoms should guide the walk, not your step count. So we covered 4 important things: when walking can be helpful for sciatica, how to make walking more comfortable, how centralization and peripheralization can help you monitor your symptoms, and the warning signs that tell you when it's time to stop. The main takeaway is that walking isn't simply good or bad for sciatica. What matters is how much you do, how you walk, and most importantly, how your symptoms respond to it. Of the adjustments we covered, which one made walking feel more comfortable? Was it taking shorter steps or slowing down your pace? Drop a comment below and let me know. If you found value in this video, please give it a like and share it with somebody dealing with sciatica. Doing that helps more people find practical, non-surgical solutions that may help them move better and feel better. Be sure to subscribe if you really want solutions for pain relief, better posture, and clear understanding of what's causing your symptoms, so you know exactly what to do next. Now, if you'd like to learn 5 exercises you can use to help relieve sciatica and leg pain, you should watch this video next. I'll show you 5 of my best sciatica pain relief exercises and explain how we use these types of movements to help patients reduce their symptoms and get moving again. So go watch this video next.